Mometasone Furoate Aerosol, spray with pump is a medication used to prevent and treat seasonal and year-round allergy symptoms, such as stuffy/runny nose, itching, and sneezing. It is also used to treat certain growths in the nose, known as nasal polyps. Mometasone belongs to a class of drugs called corticosteroids, and it works by reducing swelling, inflammation, in the nasal passages. The recommended dosage is usually 1 or 2 sprays in each nostril once a day. It is best to use it at the same time each day for the best results. Before using this medication, make sure to read and follow all directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. To use this medication in the nose, gently blow your nose before using this drug. Shake the bottle well before each use and follow the instructions to properly prime the spray pump. Then, remove the protective cap before use. Close one nostril by pressing it with your finger, tilt your head forward, and carefully insert the nasal applicator into the other nostril. Press down firmly on the bottle to deliver the prescribed number of sprays. Do not spray in the eyes or mouth. Breathe in gently through your nose and out through your mouth. Repeat in the other nostril. Wipe the applicator tip and replace the plastic cap. Avoid blowing your nose for 15 minutes after using this medication. If a child is using this medication, an adult should supervise the child. The dosage of this medication is based on your age, medical condition, and response to treatment. Do not increase your dose or use this drug more often or for longer than directed. It's important to know that this medication does not work right away. Some people will feel this medication working within 1 to 2 days, but it may take up to 2 weeks before the full benefit of this drug takes effect. When using mometasone to prevent seasonal allergy symptoms, you may need to start this medication 2 to 4 weeks before pollen season begins. It's also important to keep track of the number of sprays used from the bottle. Discard the bottle after you have used the number of sprays specified on the manufacturer's package. And make sure to tell your doctor if your symptoms do not improve or if they worsen. Some common side effects of Mometasone Furoate Aerosol spray with pump may include nose/throat dryness or irritation, blood-tinged mucus/phlegm, and nosebleeds. If any of these side effects persist or worsen, it's important to contact your doctor or pharmacist. If your doctor has prescribed this medication, it's because they have determined that the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor if you experience any of the following serious side effects: pain/sores in your nose, white patches in your nose/mouth, painful swallowing/trouble swallowing. In rare cases, corticosteroids given in the nose may be absorbed into the bloodstream, leading to side effects of too much corticosteroid. These side effects are more likely in children and people who use this medication for a long time and in high doses. If you experience unusual/extreme tiredness, weight loss, headache, swelling ankles/feet, increased thirst/urination, or vision problems, it's important to inform your doctor immediately. While a serious allergic reaction to this drug is rare, seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. Remember that this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using mometasone, make sure to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions. Also, be sure to let your doctor or pharmacist know about your medical history, especially if you have had any eye problems, infections, or recent nose problems. Avoid contact with anyone who has a contagious infection, and talk to your doctor if you have been exposed to an infection. Using corticosteroid medications for a long time may make it more difficult for your body to respond to physical stress, so be sure to inform your doctor if you are scheduled for surgery or emergency treatment. Before undergoing any surgical procedures, inform your doctor about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If using this medication for a long time, it may temporarily slow down a child's growth, so it's important to have regular checkups with the doctor. During pregnancy, use this medication only if clearly needed, and discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to note that Mometasone Furoate Aerosol, spray with pump, may interact with other medications, which could affect how it works or increase the risk of serious side effects. This is why it's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's also important to never start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Mometasone Furoate Aerosol, spray with pump. If you suspect an overdose and notice severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can contact a provincial poison control center. If you are using Mometasone Furoate Aerosol, spray with pump for a long time, your doctor may want to do some medical tests, such as nose or eye exams, and measure the height of children. It's important to keep all your regular medical and lab appointments. Make sure to consult your doctor for more details. If you are using Mometasone Furoate Aerosol, spray with pump on a regular schedule and happen to miss a dose, simply use it as soon as you remember. If it's close to the time of your next dose, it's okay to skip the missed dose and continue with your regular schedule. Avoid doubling the dose to make up for the missed one. Stick to your regular dosage and timing for the best results. When it comes to storing Mometasone Furoate Aerosol, spray with pump, it's important to follow the specific storage instructions provided on the product package or by your pharmacist. Make sure to keep all medications out of reach of children and pets. Remember not to flush this medication down the toilet or pour it into a drain unless you are specifically instructed to do so. When the product reaches its expiration date or is no longer needed, be sure to dispose of it properly. You can consult with your pharmacist or local waste disposal company for guidance on how to do this. In terms of daily usage, the recommended dosage of Mometasone Furoate Aerosol, spray with pump will vary depending on your individual medical condition. It is usually used once or twice a day, with the exact frequency and dosage determined by your healthcare professional. It's important to use this medication regularly to get the most benefit from it. The optimal time to use this medication may also vary, but it is generally recommended to use it at the same time each day. This will help you remember to use it consistently and can maximize its effectiveness. Always follow your doctor's instructions and ask them any questions you may have about using Mometasone Furoate Aerosol, spray with pump. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.